The presence of antibodies in your bloodstream is abnormal and implies that there is a problem with your immune system. Your body should never produce antibodies against its own tissues. If this occurs, your immune system will eventually destroy the target of its attack, which in the case of Graves' disease or Hashimoto's thyroiditis would be your thyroid. However, if there was a way to prevent this destruction, you could effectively put your disease into remission. Unfortunately, conventional medicine doesn't offer many effective treatments for lowering thyroid antibodies. There are many effective natural therapies available that I personally find most appealing, such as over-the-counter supplements. However, it's important to note that while supplements can be beneficial, not everyone can benefit from them, and they won't solve the issue entirely. Instead, some people may find that taking thyroid medication and waiting to see how things go fills the gap between this option and supplementation. There are two main categories into which supplements that help lower thyroid antibodies fall that patients and people actually desire to fall into. First on the list are supplements that have been demonstrated in clinical trials to lower thyroid antibodies. These are fairly straightforward. They are supplements that have been tested in humans, typically under a placebo-controlled setting where researchers have administered these supplements to a group of subjects over time and have measured the subject's antibodies both before and after the treatment. After adjusting for as many variables as feasible, studies have demonstrated that some supplements can actually lessen or diminish thyroid antibodies. Secondly, there are supplements that may be helpful based on their recognized physiological function and anecdotal evidence. These supplements may be effective since we know how autoimmune disorders begin, develop, and progress, as well as how the target vitamin or botanical might have a favorable effect on that procedure. This category of supplements also contains anecdotal data, which indicates that other thyroid sufferers have taken them successfully at some point. However, the main difference between these two categories is that one has been shown to be effective in human research while the other has not. I can't tell you how many times I've given thyroid patients supplements that should work based on everything I've read and learned, but they don't provide the benefit they are supposed to. Conversely, there are plenty of times when I've given people supplements that have never been proven to work, and lo and behold, they seem to work great. This is where things can get frustrating. Just because something has been proven to work in a clinical study, even in a placebo-controlled study, doesn't mean that it will work for you. To help you experiment and determine what works best for you, I'm providing you with information on both categories of supplements. With that in mind, let's get started with the supplements that have been shown to be effective. Nella sativa is at the top of the list. The plant that yields black seeds is called Nella sativa, and it has the distinction of being one of the few plant-based substances that has been demonstrated in a placebo-controlled study to reduce thyroid antibodies. According to this study, consuming 2 grams of Nella sativa for 8 weeks without any other interventions caused a 50% decrease in TPO antibodies when compared to the placebo. Patients who took Nella sativa throughout this time period also experienced improvements in their TSH and T3 levels in addition to a stable dose of levothyroxine. This suggests that this plant-based chemical has prothyroid and pro-immune advantages. As I've mentioned in previous videos, I believe black seed oil is superior to Nigella sativa powder because it's easier to concentrate the dose and you can standardize the active ingredients, number 2 being selenium. This study used Nigella sativa powder at a dose of 2 g per day, but you can probably also get similar or better results using either black seeds or black seed oil. If you have an autoimmune thyroid condition of any kind, taking selenium is a no-brainer due to research that support its use and our growing understanding of its physiological mechanisms. Thyroid gland inflammation and damage, which is frequently self-induced during the production of thyroid hormones, are the root cause of autoimmune thyroid diseases. Selenium deficiency makes the thyroid gland more vulnerable to oxidative stress by preventing hydrogen peroxide damage. If the thyroid gland is damaged, the proteins within can leak into the bloodstream and interact with your immune system. If you made it this far into the video, thank you. These videos take a lot of effort and time to make, so if you enjoyed them, please hit the like button, subscribe to the channel. This goes a long way in helping us grow. That said, back to the video. Since selenium is required for the synthesis of glutathione, it stands to reason that taking supplements of it could protect the thyroid gland and reduce thyroid antibodies. This is supported by certain studies, one of which found that participants taking 200 micrograms of selenium as sodium selenite experienced a 40% decrease in TPO antibodies and a 10% decrease in thyroglobulin antibodies. However, the results did not reach statistical significance, suggesting that the results could have been the result of chance. Additionally, be aware that there is conflicting information about whether or not selenium can truly aid in the reduction of thyroid antibodies. According to my observations, the main factor determining whether or not selenium will be beneficial is your current level of the mineral. If it is already optimal, adding more selenium is probably not going to help. But if you have been deficient in selenium for a long time, there's a good chance you will benefit from taking it. The third item is inositol. When it comes to your thyroid, inositol, which resemble sugar and are naturally occurring in the body, have a variety of positive effects because they function as secondary messengers inside your cells. Through the inositol-dependent pathway, inositol increases the TSH receptor stimulation's subsequent consequences. Since thyroglobulin is the target of thyroglobulin antibodies, which are frequently found in both Hashimoto's and Graves' diseases, it makes sense that optimizing the function of this protein may benefit those with these conditions. This pathway, when activated, regulates the function of thyroglobulin, a protein used to create thyroid hormone. It not only has a direct effect on thyroid hormone, but also on thyroglobulin levels. A few research have also provided evidence in favor of this notion. One such study found that taking myo-inositol and selenium together for 6 months decreased TSH levels by 27%, thyroglobulin antibodies by around 16%, and TPO antibodies by 133%. Patients who took this combination of supplements also experienced improvements in their free T3 and free T4 levels during the same time period. Elevated thyroid peroxidase antibodies are less common than elevated thyroglobulin antibodies. But if you have them, you should think about using isothiopentol to maximize thyroglobulin function. Finally, there is the reduction of iodine. Obviously, this is a stretch to include here because we're not discussing supplementation. But rather than taking one, the reason this works is that consuming too much iodine has been proven in numerous studies to raise thyroid antibodies in those who are vulnerable. It's possible that normalizing your iodine intake, roughly 150 to 300 micrograms per day, will help your thyroid antibodies return to normal. The benefits of reducing iodine intake on thyroid antibodies are likely to be seen only if you are currently or have previously been taking a high dose of iodine greater than 1,000 micrograms per day over an extended period of time. This recommendation is based on plenty of population studies where this exact trend has been shown to occur. Number 1 on this list is vitamin D. If you're going for low-hanging fruit, then vitamin D is the lowest you can go. It's hard to know for sure if taking vitamin D will actually lower your thyroid antibodies. The relationship between thyroid antibodies and iodine intake is more complex than you might think, so if you want to learn more, make sure to watch my other videos on this topic. In addition to these 4 supplements that have been proven to work, there are plenty more that may be as well. Just keep in mind that these do not have the same studies supporting their use, so their benefits may be hit or miss. However, it's a really safe therapy that might benefit the body physiologically. Since vitamin D functions more like a hormone than a vitamin and serves to maintain the immune system and endocrine system in addition to controlling calcium, some people refer to it as hormone D rather than vitamin D. The issue with taking vitamin D supplements is that the effects are inconsistent. While some research indicates that supplementing with vitamin D in the presence of pre-existing vitamin D deficiency may positively affect thyroid antibodies. Other research indicates that there may be no beneficial effects on the immune system or thyroid. This is one of those supplements that sounds complicated, but it's actually quite simple. Regardless of the type of thyroid disease they have, all thyroid patients should have their vitamin D levels checked. And if they are found to be low, they should take action. This is because even if vitamin D doesn't directly benefit your thyroid, which is debatable, it may still have general health benefits that include improved mood, calcium levels, reduced risk of autoimmune diseases, and more. If you want even more benefits, you may want to combine it with number 2, fish oil. In a large-scale study including over 25,000 participants, the combination of fish oil and vitamin D has been proven to reduce the risk of all autoimmune illnesses by as much as 22%. Many studies have demonstrated the anti-inflammatory effects of fish oil, which are most likely mediated by the oil's EPA and DHA content. This suggests that both of these compounds have some role in immune system regulation, and that taking both is preferable to taking one or the other. The ingestion of meat, poultry, and seed oils elevates the omega-6 fatty acid arachidonic acid, which these long-chain fatty acids assist balance. Since thyroid autoimmune diseases are essentially inflammatory diseases, it makes sense that taking an anti-inflammatory substance would likely have some benefit on the underlying disease. Although there is no proof that taking fish oil will lower or reduce thyroid antibodies, it seems plausible that they are at least beneficial given our understanding of how they work in the body and their known documented benefits. A relative imbalance in arachidonic acid and omega-3 fatty acids promotes inflammation and very likely makes autoimmune diseases worse. Given that not enough individuals consume fish oil and that it may benefit the thyroid, consuming them is a wise choice. This brings us to magnesium, which is number 3. Magnesium is essential for many physiological processes since it co-activates more than 300 distinct enzymes. Given that we know that decreased magnesium levels increase the likelihood of Hashimoto hypothyroidism and high thyroid antibodies, one or more of these probably affect thyroid function and the immune system. At first look, this sounds like a no-brainer because we also know that 20 to 25% of Americans do not consume enough magnesium. However, while taking magnesium does have many benefits for thyroid patients, it does not seem to suppress thyroid antibodies. If you have Hashimoto thyroiditis or Graves' disease, it's still a fantastic idea to take supplements of magnesium given its benefits and the likelihood that many of you are deficient. However, don't expect on it to cure your immune system. If you're trying to lower your thyroid antibodies, I'd also advise looking at your diet, which means you should watch this video next. I believe this to be the case, and the evidence seems to support it. In addition, most thyroid patients who take supplements report feeling better.